TikTok. Welcome back to the channel, everyone! It's Dr. Dustin Portela here, your friendly neighborhood board certified dermatologist. And today we're diving into one of the internet's most oddly satisfying corners. Yes, we're talking about viral pimple-popping videos. But now, before you cringe or click away, hear me out. These clips aren't just gross entertainment. They can actually teach us a lot about how our skin works, what goes wrong when pores get clogged, and even how we can prevent those stubborn breakouts in the first place. So while we'll be reacting to some blackhead cysts and a few epic extractions, TikTok, we're also going to break down the real science behind them in a way that actually makes sense for your skincare routine. I've been a practicing dermatologist for years, and trust me, what you see on your screen is often just the surface of a much bigger story happening under your skin. Every pop has a lesson from oil production and bacteria buildup to why squeezing at home might do more harm than good. So if you've ever wondered, what's really inside those bumps, or why do some pimples explode while others just sit there for weeks, you're in the right place. Stick around because we've got some incredible clips lined up, and I'll be sharing how a dermatologist sees what you see. Plus, how to take care of your skin the right way after watching these satisfying extractions. And hey, if you're new here, check out my podcast, Between Two Derms, where we talk all things skin health. And if you're looking for dermatologist-approved products, you can find them over at my clinic's site. Before we jump in, I want to know, what's your favorite type of extraction to watch blackheads, cysts, or those long, stringy ones? Drop it in the comments. Let's see who's brave enough to admit it. Oh, wow. Okay, that one's definitely a juicy one. You can almost hear the collective "oh" from everyone watching this clip. Now, while your brain's busy deciding whether you're fascinated or mildly horrified, let's talk about what's actually going on under the skin when something like this happens. What we just saw was basically a cyst doing its grand finale performance. Inside that bump, you've got a combination of oil, or what we call sebum, mixed with dead skin cells that got trapped in a pore. Normally, your pores are like tiny chimneys, helping that oil flow to the surface to keep your skin moisturized. But sometimes chimney gets clogged. When that happens, everything starts backing up like a traffic jam under your skin. If the top of the pore stays open, oxygen gets in and that trapped gunk oxidizes. Boom. You've got a blackhead. It's not dirt, by the way. It's just your natural oil turning dark from exposure to air. If the pore closes over, trapping oil and bacteria inside, you get a whitehead. Same situation, just no oxygen getting in, so it stays pale and trapped under the surface. Now, when your immune system sees all that oil and bacteria stewing together, it basically sounds the alarm. White blood cells rush in to fight off the bacteria, and that's how you get pus. Pus is really just your body's battle leftovers, a mix of dead white blood cells, bacteria, and debris. Gross, yes, but kind of amazing, right? Your body's literally cleaning up the mess. The cysts, those big, deep ones that seem like they have their own heartbeat, are a bit different. That's when the blockage happens deeper in the skin, and your immune response traps everything in a little bubble of inflammation. It's like your skin built a tiny bunker to contain the chaos. That's why cystic acne hurts. It's pressure, inflammation, and swelling all happening under the surface. No amount of squeezing at home is going to fix that. In fact, that's where people usually get into trouble. I know it's tempting. Watching that pop in the video feels satisfying. You see the pressure release, the skin flatten out, and you think, I could totally do that myself. But remember, what looks like a simple squeeze on camera is often done under sterile conditions by professionals who know exactly how to minimize trauma and prevent scarring. When you try it at home, you risk pushing bacteria deeper, spreading inflammation, and creating long-term dark marks or even permanent scars. Now back to the clip. Look closely at that creamy material coming out. That's not all pus. A lot of it is keratin, the same protein that makes up your hair and nails. It builds up inside the pore and thickens over time, especially if your skin is producing extra oil or you're not exfoliating regularly. That's why people who are acne prone often benefit from ingredients like salicylic acid or retinoids. They help keep those chimneys clear so the oil can flow naturally instead of getting stuck and turning into a mini volcano. Here's a good analogy. Imagine your skin like a busy kitchen. The oil glands are the fryers. They're supposed to produce oil to keep things running smoothly. But if no one cleans the filters or the exhaust vents, all that grease starts to build up. Eventually, something's going to pop, literally. Regular cleaning and maintenance keep things from turning into a greasy disaster, and that's really the key takeaway from this clip. What we see as a gross but satisfying pop is actually your skin's way of telling you it's overwhelmed. It's producing too much oil, shedding too many dead cells, or reacting to hormones and bacteria. Once you understand that, acne becomes less of a mystery and more of a signal. your skin communicating that it needs a little balance and care. Talk. So here's your quick dermatologist tip. If you're getting these kinds of deep or frequent breakouts, don't rely on popping videos for relief. Use them for education instead. Build a skincare routine with a gentle cleanser, a chemical exfoliant like salicylic acid to keep pores clear, and a non-comedogenic moisturizer to support healing. And if those cystic ones keep coming back in the same spot, that's your cue to see a dermatologist. We have treatments that go way beyond what you can do at home. All right, Now I've got to ask, be honest, would you pop this one yourself or leave it to a pro? Drop your answer in the comments below. I'm curious how many of you would reach for the gloves versus the popcorn. All right, that's a close up. If I've ever seen one, you can practically see every pore waving hello. TikTok. And there it is, that slow squeeze, the satisfying little string coming out of the nose. I get it. That's one of those moments that's equal parts gross and fascinating. But here's the thing. What you're seeing right now isn't actually a blackhead. It's something totally normal called a sebaceous filament. I know. The internet has trained us to believe every little dark dot on the nose is a blackhead waiting to be popped. But let's clear this up. Literally and scientifically. Sebaceous filaments are tiny hair-like structures that line your pores. They're made up of a mix of sebum, that's your skin's natural oil, dead skin cells, and a little bit of bacteria, all neatly organized inside the pore. Their whole purpose is to help guide oil to the surface of your skin. It's your skin's built-in oil delivery system. Not a problem to fix. So when you squeeze them out, that little grayish string that comes out, that's not a plug of dirt or infection. It's your skin doing its job. It refills within a few days because, well, your pores never stop producing oil. That's why people get frustrated. They think, I just cleaned this last week. No. You just removed something that's supposed to be there. It's like wiping off condensation and being surprised when it comes back tomorrow. Blackheads, on the other hand, are actual blockages. They form when too much oil and dead skin get trapped and the top of the pore stays open. Oxygen gets in, the oil oxidizes, and that's why it turns black. So while blackheads are a mild form of acne, sebaceous filaments are just part of your natural skin anatomy. Everybody has them, even people with flawless complexions. You can't get rid of them, and you shouldn't try. Now, watching this video, it's easy to get tricked. The extractor tool glides across the nose, and all those little dots come out one by one. It looks productive, right? But here's what I tell my patients: that satisfying squeeze might make your skin look cleaner for a few days, but it's temporary. The pores are just going to fill right back up. Worse, over-extracting or using too much pressure can stretch out the pores or even damage the skin surface. The better approach is to manage sebaceous filaments instead of fighting them. You can't erase them, but you can make them less noticeable by keeping oil production balanced and the pore linings clear. Think of it like maintaining a clean window. You can't stop fingerprints from ever appearing again, but you can keep it from getting smudged and greasy. Here's what actually works: gentle, consistent care. Start with a mild foaming or gel cleanser that removes oil without stripping your skin. Harsh scrubs or alcohol-heavy toners can backfire by drying your skin out, and when that happens, your body produces more oil to compensate. Not exactly the goal, right? Then add a chemical exfoliant a few times a week, something like glycolic acid or salicylic acid pads. Salicylic acid in particular is oil-soluble, which means it can sneak into those pores and dissolve excess sebum right at the source. It keeps your pores clear without you having to go all Mission Impossible on your nose with extraction tools. And don't skip moisturizer. I know it sounds counterintuitive to put moisture on oily skin, but when you hydrate properly with a lightweight, non-comedogenic moisturizer, your skin stops overproducing oil to compensate for dryness. Balanced skin equals calmer pores. If you want to minimize the look of sebaceous filaments before a big event, you can use a clay mask or a gentle pore strip once in a while, but don't go overboard. Think of those as short-term visual touch-ups, not long-term fixes. Your pores aren't enemies. They're essential, and let me say this one louder for the people in the back. You cannot permanently remove sebaceous filaments. The videos that promise poreless skin are basically promising unicorns. Everyone, even babies, has them. If you zoom in close enough, those tiny dots are always there because your skin needs them to function. So when you're scrolling through those oddly satisfying extraction clips, remember, not every squeeze is a success story. Sometimes it's just your skin being, well, skin. Looks satisfying, absolutely, but don't be fooled. This isn't acne. If you want your pores to look smaller and your skin to stay clear, focus on routine overreaction, gentle cleansing, regular exfoliation, balanced hydration. That's your real skincare power trio. And now I've got to ask, did you know these were normal before watching this? TikTok, drop a comment. I'm curious how many minds we just cleared up today, literally and figuratively. Okay, first off, wow. Look at that video quality. Talk. You can practically count every pore in 4K, and doesn't that extraction look F2 perfect? Like the gunk just slides out like toothpaste, the skin magically stays flawless. Talk, and somehow there's zero redness afterward. It's satisfying, sure, but let's be real. That's not what extractions actually look like in real life. There's a lot happening behind the scenes of those TikTok perfect pops that most people don't see. What you're watching is often the highlight reel, literally. These videos are edited, filtered, and optimized for the satisfaction factor. Good lighting, macro lenses, and even post-edit smoothing can make every extraction look like it was done by an angel with steady hands. Real skin though, it's textured, it bleeds a little, and it gets red afterward. And that's completely normal. A lot of viral extraction creators also prep the skin the way more than you might think. They might steam it beforehand to soften the pores, use numbing creams, or even apply oils to reduce friction. But when we, at home, see that smooth glide, we assume we can just grab a random tool, press down, and get the same results. Spoiler, you can't. Please, don't try this with your kitchen tweezers. When you do extractions incorrectly at home, a few bad things can happen. The most common one is infection. Our hands carry bacteria, and even clean-looking tools can introduce new germs if they aren't properly sterilized. You might clear one blackhead but end up with 3 inflamed pimples or even a painful abscess. Then there's scarring. That's the big one. The skin around your nose and cheeks is delicate. Apply too much pressure or dig too deep, and you can damage the tissue underneath. Leaving behind small pits or dark marks that can take months to fade. Speaking of marks, post-inflammatory hyperpigmentation is another sneaky side effect. That's when your skin overreacts to trauma and leaves behind a dark spot even after the pimple's gone. It's especially common in medium to darker skin tones. So, what looked like a small victory in the mirror turns into a long-term reminder that maybe DIY dermatology wasn't the best weekend project. Now, let's talk about what actually happens in a professional extraction. When I or another dermatologist perform these procedures, there's a whole protocol in place. We start by cleansing and prepping the skin, removing surface oil, bacteria, and debris. Sometimes we use steam or warm compresses to loosen up the pores. Then we sanitize the cum-dome extractor, that little metal loop you see in all the videos, or we use sterile gloves and gauze. The pressure we apply is calculated and gentle, targeting the blockage without damaging the surrounding skin. And yes, there's an art to it. Every pore has a slightly different angle, and every type of blockage, blackhead, whitehead, or milia, needs a slightly different approach. Professionals know how to coax the debris out rather than force it. And afterward, will usually disinfect the area and apply something soothing like a hydrating serum or a bit of antibacterial solution. That's why, when done correctly, the skin heals quickly and looks clean instead of angry. Those TikTok clips, they usually skip all that context. You don't see the pre-cleans, the sterilization, or the aftercare. You just see the pop. It's like watching a highlight reel of a recipe where they show you the cake, but not the hours of mixing and baking that went into it. And honestly, that's fine, it's entertainment. But if you try to replicate it without the training or tools, that's when problems start. So, what can you safely do at home if you can't resist the urge to clean things up? Stick to products that mimic a professional result without the risk. Look for salicylic acid cleansers, glycolic acid toners, or clay masks that gently dry out impurities over time. Retinoids can also help regulate cell turnover, preventing future blockages from forming in the first place. It's a slower, safer version of what those extractions aim to do. And please keep your hands off your face, at least most of the time. The more you poke, prod, and pick, the more likely you are to end up with irritation or scars. Remember, a dermatologist's office has sterile equipment, proper lighting, magnification, and years of training. Your bathroom mirror and a YouTube tutorial just aren't a substitute for that. So next time you're watching one of those flawless pop videos and your fingers start twitching, take a breath. Remind yourself that filters and edits make everything look cleaner than it really is, and maybe just enjoy the satisfaction virtually. Yeah, all right. I've got to know, have you ever tried extracting a blackhead yourself? Be honest, drop a comment. I promise this is a judgment-free zone. We've all been there at least once. Okay, that's a close-up masterpiece right there. You can actually see those deep, dark blackheads popping out like tiny corks being pulled from a bottle. Super satisfying, right? But before your brain says, that's a lot of dirt. Let me stop you right there, because what you're seeing isn't dirt at all. It's chemistry. Yeah, real high school, lab-level chemistry happening right on your skin. So let's geek out for a second, talk. What you're looking at in that video, those tiny dark specks that everyone loves to hate, are called open comedones. The word comedone just means a clogged pore. Inside that pore, talk, your skin's natural oil called sebum mixes with dead skin cells and a little bit of bacteria. Normally that combo should flow out easily like a self-cleaning system. But sometimes, talk, at the exit gets blocked. Think of it like a traffic jam in your skin's oil highway. Now here's where the cool part happens. Talk, when the top of that pore stays open, meaning air can reach the trapped oil, the sebum inside reacts with oxygen. This process is called oxidation. Talk, the same thing happens when you cut open an apple and it turns brown after a few minutes. The oxygen changes the chemical structure of certain molecules. In this case, talk, the ones in your skin's sebum. That's what turns the top of the blackhead dark. So that black tip, it's not dirt, pollution, or anything you forgot to wash off. Talk, it's literally the result of your skin doing chemistry in real time. Kind of amazing when you think about it. Now, in this clip, you can see that some blackheads come out in long, talk, thread-like shapes while others are round and compact. That's because blackheads form at different depths. Shallow ones oxidize faster, getting that classic black look. Talk, while deeper ones might look more gray or even flesh-colored at first. The longer they've been sitting there, the darker they get. Talk, which is why the nose and forehead, areas with higher oil production, tend to collect more of them. Let's connect this to skincare science for a second. TikTok, your sebaceous glands, those are your oil factories, are constantly producing sebum to keep your skin soft and protected. The problem isn't the oil itself. Talk, it's when that oil mixes with dead skin cells faster than your pores can clear it out. That's why consistent cleansing and gentle exfoliation are key. Talk, not because you're washing dirt out, but because you're helping your skin's natural cycle run smoothly. Talk. And this is important. Cleansing too often or using harsh scrubs can actually make things worse. If you strip away too much oil, your skin freaks out and produces more to compensate, creating an even oilier situation. So gentle is the name of the game. A mild foaming or gel cleanser once or twice a day is enough for most people. Now, talk, if you really want to minimize those dark blackheads, this is where the science-backed products come in. I and BHA exfoliants, like glycolic acid and salicylic acid, are your best friends here. Glycolic acid works on the surface to dissolve dead skin cells, keeping the pores from clogging in the first place. Salicylic acid, on the other hand, is oil-soluble, meaning it can actually penetrate inside the pore, breaking down the sebum and helping prevent oxidation before it even starts. Think of it as a little chimney sweep for your skin. Retinoids are another gold standard ingredient. They help regulate how your skin cells turn over, which means fewer blockages, smoother texture, and smaller looking pores over time. They don't shrink pores technically, but they keep them clear so they appear tighter and more refined. And unlike those extraction videos where the satisfaction is instant, retinoids are more of a long game. You don't get that pop, but you do get clearer, healthier skin in the long run. Back to the video, you'll notice that after each extraction, the skin around the area looks a little red and open. That's normal, but what they don't always show is what happens next. That empty pore can refill quickly if it's not cared for properly. That's why aftercare is so important. A gentle toner, a light moisturizer, maybe even a dab of niacinamide to calm the skin and reduce oiliness. Your skin will thank you. Here's another fun way to visualize what's happening. Imagine the pore as a little glass tube filled with cooking oil. Leave it open to the air for a while, and you'll notice a thin layer at the top starting to darken as oxygen interacts with it. That's exactly what's happening on your skin. Tiny chemical reactions repeating over and over across thousands of pores. It's not dirt, it's oxidation, and it's completely harmless. TikTok. So next time you're watching one of these blackhead clips, and let's be honest, we've all gone down that rabbit hole at 1 a.m., remember that every pop is a mix of biology and chemistry at work. Your skin isn't dirty, it's just doing its job. Keep your skincare simple, scientific, and consistent. Cleanse gently, exfoliate smartly, moisturize daily, and let your skin's chemistry do its thing. And now I've got to ask, did you think blackheads were dirt before watching this? TikTok. Be honest in the comments. I won't judge. I used to think the same thing before I went to med school. Oh boy, that's a tough one to watch. You can practically feel the pressure through the screen. You know that moment when someone's clearly squeezing way too hard and you just want to yell, "Stop! Abort mission!" Yeah, that's what's happening here. This is the kind of DI extraction that makes every dermatologist cringe a little because we know exactly what's about to follow. Swelling, redness, and possibly a trip to urgent care. Now, don't worry. If you've ever done this, you're not alone. We've all been there. That one stubborn pimple just sitting there, begging to be popped, and your brain says, it'll be fine, I've seen this done on TikTok. But Here's the truth, most of those videos show the best case scenario, perfect lighting, TikTok, sterile tools, and someone who probably knows what they're doing. Real life skin, it doesn't always cooperate. And when you go in too deep, too fast, or with the wrong tools, things can go south quickly. So let's talk about what went wrong here, medically speaking. When you squeeze a pimple that's not ready or use unsterilized fingers or tools, you're creating tiny tears in the skin that gives bacteria an open invitation to move in and start a party. The redness and swelling you see afterward, that's inflammation, your body's version of, oh, we've got a situation. Sometimes it stays local and clears up, but other times it can lead to infection, abscesses, or cystic lesions that take weeks to heal. And then there's trauma. When you press too hard or at the wrong angle, you can actually rupture the follicle wall beneath the surface. That means all that bacteria and oil don't go out, they go in. The gunk spreads into the surrounding tissue, and suddenly you've turned one little whitehead into a painful, inflamed crater. That's why you'll often see a small bump grow into something that looks twice its size overnight. It's not bad luck, it's biology doing damage control. And let's not forget post-inflammatory hyperpigmentation, the dark marks that linger long after the pimple's gone. For people with more melanin in their skin, that discoloration can last for months. So instead of a quick fix, you end up with a long-term reminder that DIY dermatology doesn't always go as planned. I totally get it, though popping is weirdly satisfying. There's that instant gratification when the pressure releases, the skin flattens, and you think, mission accomplished, but beneath that quick win is microtrauma, broken capillaries, inflammation, and delayed healing. It's kind of like fixing a leaky faucet with duct tape. Sure, it works for a minute, but you'll pay for it later. So what should you do instead? If you're dealing with mild blackheads or whiteheads, over-the-counter treatments are your best bet. To look for products with salicylic acid or benzoyl peroxide. They work beneath the surface to clear out pores and reduce bacteria. Retinoids are another powerhouse option. They help prevent clogged pores in the first place by speeding up cell turnover. If you've got deeper, more painful pimples, those big cystic ones, it's time to call in the pros. Dermatologists can perform safe extractions using sterile instruments, numbing agents, and controlled pressure. We can also use treatments like cortisone injections to reduce inflammation overnight. And for people who deal with recurring breakouts, professional chemical peels or medical-grade facials can make a huge difference. These treatments exfoliate safely, encourage healing, and improve texture without the trauma of DIY popping. And for those of you thinking, but I can't help it, I need to do something, here's a compromise. If you absolutely must tackle a pimple at home, wait until it has a clear whitehead on the surface. That means it's closer to being ready. Then wrap clean tissues around your fingers, apply gentle pressure, F gentle, and if it doesn't release easily, stop immediately. No digging, no needles, and definitely no random metal tools from Amazon that haven't been sterilized since shipping day. Afterward, apply a spot treatment with benzoyl peroxide or a mild antibacterial ointment to calm things down, and resist the urge to keep touching it. That's when you end up with swelling, scabbing, and regrets. If you've already gone too far, don't panic. Use a cold compress to reduce swelling, a gentle cleanser to keep the area clean, and avoid makeup on that spot for a couple of days. The skin is amazing at healing itself when you give it a little grace, and let's be honest, we've all had a pimple pop fail moment, the one where you swear you're just going to clean it up a bit, and suddenly it looks like you've been stung by a bee. The key isn't to feel bad about it, it's to learn from it. Next time, maybe let a professional handle the pressure literally. So, I've got to ask, what's the worst pimple pop fail you've seen? Was it your own or someone else's viral disaster? Drop it in the comments. I promise, no judgment here. We've all made that same mistake at least once. Ooh, look at that skin. You can tell it's been through a full extraction session. There's redness, a bit of swelling. Maybe some shiny patches where the oil glands are saying, hey, what just happened? Totally normal, by the way. What we're seeing here is your skin's version of post-gym soreness. It just had a workout. Now it needs recovery time. After any extractions, whether done by a professional or hopefully not too aggressively at home, your skin barrier goes into repair mode. Think of your skin barrier like a brick wall. The skin cells are the bricks and the lipids. Your natural oils are the mortar holding them together. Extractions, cleansing, and pressure temporarily loosen that mortar. That's why your skin might sting a little when you wash your face or apply skincare afterward. It's not damage beyond repair, it's just asking for a little TLC. Right now, the main thing your skin needs is calm, moisture, and protection. After extractions, the skin's pH can shift slightly, making it more vulnerable to irritation or bacteria. You'll want to use products that support healing without clogging pores. Talk. This is not the time for harsh exfoliants, scrubs, or anything labeled tingling. Save the acids for later. Your skin's done enough chemical and physical work for the day. Start with a gentle non-foaming cleanser to remove any residue or debris. Something with hydrating ingredients like glycerin or ceramides will cleanse without stripping away those healing lipids. Pat dry, don't rub, because friction is the last thing your freshly treated skin needs, then move straight into moisture repair. Talk. One of my favorite post-extraction heroes is niacinamide. It's like therapy for your skin barrier. It reduces redness, calms inflammation, and helps strengthen the outer layer of skin so it bounces back faster. A serum with around 5% niacinamide is a sweet spot, enough to be effective without overwhelming sensitive skin. Follow that with a lightweight non-comedogenic moisturizer. Look for formulas with ceramides, squalane, or hyaluronic acid, all of which help lock in hydration and rebuild that brick wall we talked about earlier. Think of it as giving your skin a good meal after a tough workout. You're replenishing what it lost, not overfeeding it with heavy oils or fragrances. Now, if you're acne prone or have oily skin, I know the instinct might be to skip moisturizer because you're worried it'll make things greasy. But here's the twist. Skipping hydration actually tells your skin to produce more oil to compensate. Balanced hydration is what keeps your oil glands from going into overdrive. So, moisturizing after extractions isn't optional, it's strategic. The next big non-negotiable, sunscreen. After extractions, your skin is more photosensitive because the outer layer, your stratum corneum, is slightly disrupted. Sun exposure can easily lead to post-inflammatory hyperpigmentation. Especially if you're prone to dark spots after breakouts. Go for a mineral-based sunscreen with zinc oxide or titanium dioxide. They're gentle, calming, and provide immediate protection. And reapply if you're outside. Your skin's healing deserves backup. Let's talk about inflammation for a second. That redness you're seeing in the clip is your body's natural immune response. Blood flow increases to bring nutrients and oxygen to the area. It's your skin's built-in repair system kicking in. But if that redness lingers or turns into swelling, a cool compress can help soothe it. Avoid ice directly on the skin, wrap it in a clean cloth, and keep it short, about 5 minutes at a time. And please, resist the urge to cover everything up with makeup right after. I know it's tempting, especially if you've got that freshly treated glow mixed with a bit of redness. But foundation and concealer can clog those newly opened pores, undoing all the progress you just made. Give your skin at least 24 hours to breathe before applying anything heavy. If you really want to go the extra mile, a calming face mist with thermal water or green tea extract can help cool and hydrate the skin without disturbing it. And for those who love a good professional touch, post-extraction treatments like LED light therapy or soothing facials can accelerate recovery and minimize inflammation. These treatments help the skin heal faster by supporting collagen and calming redness. Basically, a spa day with a scientific backbone. Your post-extraction skincare should feel gentle, nourishing, and boring in the best way possible. No stinging, no burning, no 12-step routines. Just cleanse, hydrate, protect, and let your skin do what it's naturally good at. Healing itself. And if you notice new breakouts popping up a few days later, don't panic. That's just your skin purging leftover debris and adjusting to the reset. Keep your routine consistent, avoid picking, and you'll be rewarded with smoother, calmer skin in about a week. Watching this clip, I can't help but smile, because while the redness might look intense now, it's actually a sign of your skin doing its job. It's healing, regenerating, and getting stronger. Kind of beautiful in a scientific way. So tell me, would you want to see a full aftercare video next? Something where we walk through exactly what to use when and how your skin changes in the days after an extraction. Drop your answer in the comments. Your skin will thank you for it later.